Before entering my patient's room, I'm going to check his charts for gender, age, and ethnicity, and also any medical problems that would alter my head-to-toe assessment process or any precautions I would need to take. The only thing I will have with me is a notebook that has the vital signs pre-recorded to save time in this process. There's nothing else on the notebook.
Okay. Scan the room.
Hello, sir. My name is Gregory Hedrick. I am going to be your student nurse today. Can I get your name and date of birth, please?
Cameron Camden, 8/31/99.
Okay. We are going to be doing your head-to-toe assessment today. Can you tell me where you're at?
I am at Fairgrounds Apartments in Lynn, Missouri, apartment 112C.
All right.
Gregory Hedrick's room.
All right. Can you tell me what we're seeing you for today?
I had the flu.
Okay. And you know what time it is? Or about roughly what time it is?
12:50.
Okay. I'm going to begin your head-to-toe assessment by taking your vital signs. Okay. His temperature is 98.9 through an oral route. His pulse is 74 with a regular strength. Or with a regular rhythm with a strength of 2, respiration's 15, oxygen saturation 99, blood pressure is 134/84. His weight is 155 pounds and his height is 5'9". So we're going to begin your assessment. We'll be looking at your head. So I'm going to assess the head for symmetry on both sides, which it appears symmetrical, and his skin color and is normal pink. I'm then going to test his eyes for accommodation to light and equal sizes and all that. So, I'll have you take your glasses off, please. Alright. His pupils are equal size, both about a 5 on the pupil gauge. I'm now going to test his reactiveness to the light. Both sides appear to constrict with light. So now I'm going to test his accommodation to distance. I'm going to have you look at this pin. Alright. Pupils responded correctly to the change in distance. Now I'm going to have you look at the pin, focus on the pin. Now look at the wall behind the pin. Alright, his pupils dilated to allow for more light to look at a further distance. I'm now going to look in your mouth. I'm looking at the lips to assess for any lesions, dryness, or moisture or anything like that. I'm going to have you open your mouth. Alright, I'm going to have you clench your teeth. Alright, and then move your tongue from side to side. Alright, I'm going to have you raise your eyebrows, move your eyebrows around. Alright, and flex your face, smile. Alright. I'm now done with the head assessment. I'm going to look at his neck. I'm going to have you tilt your head to the left for me. I'm going to look at your neck. Alright, there's no vein dissension apparent. I'm now going to examine the patient's chest and abdomen. I'm going to start by assessing for any heart sounds or heart defects, and I'm going to evaluate the patient's chest. I'm going to have you pull your shirt up for me, please. Alright. First I'm going to check at the second intercostal space just left to the clavicle, listening for rate, rhythm, and strength for a full minute. And then on the right side of the clavicle. And then down to the fourth intercostal space just left to the sternum. And then at the fifth intercostal space on the mid-clavicular line. Strength is a 2, rhythm is regular, and the rate was 76. The pulse rate, heart rate was 76. I'm now going to compare this to his radial pulse, and I'm going to count for a full minute that his pulse is also 76, to assess for a pulse deficit between the apical and radial pulses, and they both appear equal. I'm now going to check the lungs. I'm going to start with the anterior side of the lungs, assessing all 5 lobes bilaterally. And I would make sure that I'm warming my hands so that I'm not touching the patient cold or anything like that. And if there's any breaks in the skin's integrity, I would wear gloves. I'm going to have you breathe in deeply. And breathe out. Alright. Breathe in. Breathe out. And out. And in. And out. And in. And out. Alright. The anterior sides of the lungs appear to be free of any abnormal breath sounds such as wheezes, stridors, or anything of that nature, no crackles or rows. I'm now going to check the right middle lobe from the lateral aspect. I'm going to have you raise your arm up above your head for me, sir. Alright, breathe in. And breathe out. And in. And out. Alright, I'm going to have you sit up in bed for me. I'm now going to test or check the posterior lung sounds. Alright, and breathe in. And out. And in. In and out. Alright, one more breath for me. Alright. Alright, sounds good. No complications with breathing. I would inspect the chest for any tubes or incisions or anything of that nature, but the heart and breath sounds both appear to be normal. I am now going to check the abdominal sounds for any complications in the GI tract. I will start by assessing the lower right quadrant. Sounds good. Normal rate of 5 to 30 a minute. I will then go up to the right upper quadrant. Sounds good. All quadrants of the intestines appear to be at normal rate. You can go ahead and lower your shirt down for me, sir. I will now test for skin turgor to check for the hydration of the skin. And so I will palpate around the abdomen to make sure that everything's all right. I'll go ahead and palpate, make sure that I would listen before I palpate. I'll go ahead and palpate around the stomach, testing for the warmth of the skin, color of the skin. Everything appears to be normal. I'm now going to check the extremities. I'm going to have you go ahead and raise your arms up above your head. and then back down, and then out, without hitting the lamp. Alright, and then back down. Alright, I'm going to have you hold your hands up. I'm going to have you hyperextend your hands, or raise them up. Okay, now extend. Okay, and now flex them all the way down. Alright, there you go. I'm going to have you grab onto my fingers, squeeze as hard as you can. Alright, strength appears to be equal in both hands. Go ahead and let go. I'll then check for capillary refill in each finger. All fingers show proper oxygenation. Skin color appears to be good. Skin appears to be hydrated. Did not remain tinted and was elastic. I will then check the arms for any lesions, breaks in the skins, or discolorations. I'm now going to go ahead and assess his legs. So I'll go ahead and have you put the blanket down and look at your legs. Alright, I'm going to check the toes for any, I'll take your socks off, sir. I'm going to check the legs for any discolorations, palpate, make sure that he is getting good blood flow to the legs. I'll assess the color of the toes and the capillary refill of each toe on each leg.
Gotta take our speed.
And I'll go ahead and check for the hydration of the skin. It appears to have good blood flow to the skin. There are no, he does not have any cuts or dressings anywhere on his body. His skin is intact. And everything appears to be in normal condition. So I'll go ahead and pull this up. And then I'll follow my ending implementation steps. Now that I know that there's no swelling in the feet, legs, no edema, no pitting edema, anything of that nature, he appears to be in good physical shape for my initial head to toe assessment. I will make sure that he has everything he needs, that he's comfortable in bed, there are no wrinkles on the bed, that everything's in order. Make sure that he has a call light. Tell him I'll be back to check on him in a couple hours. If he needs anything, just hit the call light, and that's it.